Welcome to HealthWatch, presented by Novant Health. I'm your host, June Baker. Today we have a very special show planned for you. We're here at the new Novant Health Brunswick Endoscopy Center. So come on, let's take a tour of the new facility with Shelburne Stevens, the president of Novant Health Brunswick Medical Center. Hi, Shelburne. Thanks so much for taking the time out of your day today to be with us and to show us around the new Novant Health Brunswick Endoscopy Center.
Absolutely. I'm glad to have you here today, June.
Well, thank you. But before we start, let's talk exactly about where this center is located. I'm sure our patients out there would like that information.
Absolutely. Its physical address is 13 Medical Campus Drive, and it's Suite 101, and it's just right down the road from the hospital down on Highway 17. A convenient location, easy to get to.
Great. That's good information, and thank you for that. So tell me a little bit about the services that will be offered here at the Endoscopy Center.
Yeah, our providers will be doing routine endoscopies and colonoscopies here at the center for those patients who meet the criteria.
I see. And am I correct that this is Brunswick County's first outpatient endoscopy center?
You're correct. So we were excited to bring this service to the community, and as our part to help tackle the healthcare cost and bring services to a lower cost point for patients. This is exactly why we built this center here. So it's outpatient, and the copays from the majority of the patients coming here should be lower than those at the hospital.
Mm-hmm. Well, tell me, what's the difference between having a colonoscopy or any test here, between here and the hospital? What would be the difference?
Really, it's the complexity of the patient. So patients with a lot of health issues, we want to do those at the hospital because if they have different comorbidities and things and they have a higher risk factor, we want to do those at the hospital. Those patients that are routinely and relatively healthy will meet the criteria to have their services provided here.
Great, good information. Share with me who the surgeons are who will be doing their procedures here at the facility.
3 gastroenterologists that'll be performing procedures here. That's Dr. Rice, Dr. Itzkowitz, who I think you're going to meet in a minute, and Dr. Lamphere. And then we have 2 general surgeons who also perform procedures here, and that's Dr. DeSandre and Dr. Beninati.
So Shelburne, tell me, what are you most excited about with the new endoscopy center here?
As we talked about earlier, it's the lower cost point to our patients in this community, and also the convenient location. They don't have to come to the hospital and be around sick people all the time, and we've grown so much at the hospital, really just out of space. So we're excited to have a new location that's more convenient.
Great. Now I understand that one of the Novant Health clinics is right next door. Is that correct?
It is, and Novant Health Gastroenterology is conveniently next door.
And I believe we're going to see that in just a little bit. So what else is going on at Novant Health these days? Any new services that we can talk about?
We're always looking to add new services, and we keep adding new services. So as I mentioned, at the hospital, we've seen significant growth. We've added 3D mammography recently at the hospital, and then we have the mobile coach for mammography full-time now that we're able to take throughout the county and to different community events and do screenings there for women. We also have a vascular surgeon here now. We've not had that before, and he does a lot of vein procedures, so we're really excited about that. And our robotics program, we've been able to expand that a lot.
That's great.
To provide more services and specialties doing that. And also, most of our specialty clinics have satellite offices now throughout the county.
That's great. Yeah.
To make it convenient for the patient. So we have satellites in Leland, Southport, and then Carolina Shores, so patients don't always have to drive up to the hospital campus to be seen. So we're always looking to add new stuff, and we're excited about growth, and our recruiters are working really hard to bring more providers here to Brunswick County. So it's very exciting.
It is a very exciting time, and I appreciate you taking the time out of your very busy day to be with us today. And I think now we're going to meet the administrator of the clinic, who's going to take us on a tour of the center.
Excellent.
Great.
Great.
Hi, Lynette. Thanks so much for spending time with us today and showing us around this new endoscopy suite. So we're really excited to get started. But before we do, I'd love for our viewers who haven't met you yet to get to know you a little bit. So tell me about your background and your experiences.
I've been a nurse for 17 years. The last 7 of those years have been with Novant, right out here at the hospital at Brunswick. Have a critical care background, surgical services background, and recently was the manager of the med-surg department. So when the position came open here, I thought it would be a wonderful experience to kind of meld all my things
Bring
together.
It all together.
Yes.
Well, we're really excited to see the center today. Can you tell me a little bit about what we're seeing right here and talk to me about the patient's experience?
Okay. The patients would come in the front there. After they register, they'll come through that door. This is the main nurses station. So they'll be escorted around this way. And if you want to walk right over here, I'll show you the pre-post rooms. We have 14 pre-post rooms.
Okay.
They start and end in the same room.
Oh, sort of like at the hospital when they're getting ready for surgery.
That way the family can stay in here and wait on their family member. They don't have to take belongings or anything and go anywhere with them. So they'll start here. The nurses will come in, take vital signs, put the IV in. The CRNA will come in and talk to them, and the doctor will also come in and talk to them in this room.
And the visitors will be here with the patient?
Yes. Yes.
Okay.
They will stay in this room.
All right, great. Well, it looks like a very comfortable room. There's a bathroom here?
Yes. It's a bathroom, and all of our rooms are set up exactly the same.
Great. So what are your hours here at the endoscopy center?
7 to 3, Monday through Friday.
Great. Is a physician's referral necessary to have the scope done here?
No, it is not necessary. They do need to see one of our specialists, which would be one of the GI docs or one of the surgical associates docs.
That was my next question. I wondered if patients always need to be seen in the physician's office prior to having their procedure here at the endoscopy center.
They do not need a referral, so they do not need to go through their primary care physician, even though sometimes that's where the conversation starts. When you turn 50 years old and they say it's about time to get this screening, it may start there, but they don't have to have a referral.
So Lynette, what happens next? Kind of walk us through what the patient would experience from here into the procedure room.
Okay, so when the patient is ready and the team is ready, we will roll the patient out. The family is going to stay here in the room, or they can go back out to the waiting room if they choose to do that.
Okay.
We do ask that they stay on site.
Oh, of course.
So they'll be rolled this way. Before we go into the procedure room, I would like to show you some behind the scenes.
Oh, that'd be great. I like the behind the scenes stuff.
This is our reprocessing room.
Wow, what in the world?
We're very proud of this room. This is where the scopes are reprocessed. This is state-of-the-art Advantage Plus Medivators. So the scopes have serial numbers, they have a scanner. The employee scans themselves, they scan the scope, it pops up with the patient's name, it pops up with the doctor's name, so we can do tracking for infection prevention reasons. There's 2 machines, and so she can process 2 scopes at the same time. When she gets through processing, then she will hang the scope in the pass-through cabinet. She'll get several of those in there, and then she'll walk around and go to the other side and put them in the clean scope cabinet. These areas are separated. This area needs a negative pressure.
Oh, I see.
Because this is going to be the decontamination room. So you want to keep everything in here.
Extremely clean.
Yes, extremely clean. And that's the reason we have the pass-through. And then the air pressure on the other side of the pass-through is positive pressure. And that's where we keep the clean scopes. They're kept in locked cabinets. after they're processed.
I noticed there's a lot of piping on the walls and what have you. Can you talk to me a little bit about that?
I sure can. The water has to be a certain temperature, so you've got your hot and cold water mixing to get to the correct temperature, and it has to be a certain pressure when it comes through the motivator, so you have the pressure gauges there that are constantly reading the pressures.
So all of this is similar to what happens in the hospital in terms of the infection prevention and things like that.
Exactly.
So it's similar to that. Well, that's great. Well, this is, those things look amazing. They're so big and new and pretty.
They really are, and the staff that has been trained to run this equipment, they're so excited about it. They've received a lot of certifications, and so they're ready to go.
Good, great. So, where do we go next?
Okay, well, let's go to the procedure room.
Okay.
So this is where you come to actually get your procedure.
The Mileage Club is a club for children that may not be athletically inclined, and it's a walking club. The children use a lanyard to measure their miles, and each time they make a lap on the track, they scan it into a tablet, and it calculates their laps and their miles. And when they get a mile, they get rewarded with a charm that they put on their lanyard. And the charm is in the shape of a tennis shoe. And the children really enjoy using the technology. Well, because of the problem with childhood obesity in America, our School Health Advisory Committee in Brunswick County Schools recommended that we do something at our local level in our schools to engage the children to get more activity. And these children are usually not as athletically inclined, and so walking is something almost all of our children can do. Oh, they seem to love it. They really enjoy it. We've got about 45 children now.
The kids are having fun at it. They're excited to get the little feet, and some of them are making new friends. They're just all excited.
Well, we really appreciate ATMC helping us with this because we really could not do this. We just do not have the funds to purchase this type of equipment, so it's really helpful. They have helped us to purchase a tablet to calculate their laps. It has helped us to purchase the lanyards, all the charms. I hope that I can continue this program next year, and hopefully some other schools will be interested, and I'll be glad to help them get started.
This is ATMC TV, your community channel.
Welcome back. And I'm here with Dr. Itzkowitz, and thank you so much for taking time out of your day to be with us today. I really want to learn about this room and hear about all this equipment, but first I want our viewers to get to know you a little better. So tell me about your experiences, your education, and your background.
So I'm a board certified gastroenterologist. I did my fellowship at University of California, Los Angeles. I've spent 21 years active duty service in the United States Navy, where I was a former chief of GI at Walter Reed National Military Medical Center in Bethesda, Maryland.
Wow.
I most recently have been the department head of gastroenterology at Naval Medical Center Camp Lejeune, and before joining Novant.
Wow, that's great. What credentials you have, and we're so happy that you're here in our community and being able to provide services to our residents of this county. So I know that you've recently joined Novant Health Gastroenterology, correct?
That is correct.
Great. And are you one of the physicians who will be seeing and doing procedures here at the Endoscopy Center?
Yes, I will be, June.
Perfect. So tell me a little bit more about the services that you all will provide.
So we're planning in this unit particularly to be providing both screening and endoscopic procedures for symptomatic patients, both upper endoscopy and colonoscopy.
Okay. Well, let's talk a little bit about what we're seeing here in the procedure room. Let's talk about the equipment.
Yeah, so it's state-of-the-art equipment. We're starting at the head of the bed here that our endoscopic providers will be providing MAC propofol sedation. This is all the anesthesia equipment that you're going to be seeing. Patients will be on their sides on the stretcher here. Endoscopic equipment, state-of-the-art Olympus equipment, the best equipment made. These are the processors, the light sources that put light through the scope so that we can see inside the body, and monitors both for the staff and monitors for the provider providing the service at the time. So.
When we were in the room next door where the equipment is cleaned and sanitized, and they talked about it being passed through.
Correct.
And it would be up behind a locked door here and a positive pressure. Is that the locked unit back there?
Yeah, that is the locked unit. So, we're going to follow the most state-of-the-art infection control techniques that are currently recommended by national societies.
Wonderful. Infection control is so important. And I said to Lynette, this is kind of like the operating room in the hospital. It has the same sort of technique and procedures that we utilize to keep the infection down.
That's correct. Yeah.
Good. So one of the most common procedures, I would assume, would be the colonoscopy that would be done here. Remind me about what the recommendations say about how soon you should have one and how frequently should you have them.
Yeah, so for average risk individuals, particularly Caucasians, average risk colon cancer screening is recommended to start at age 50. For those who are African American, we recommend starting screening at age 45 because African Americans actually have more advanced polyps and earlier cancers. So it's one of those things that's not very well known out in the African American community, and it's one of those things that we want to stress to our viewers. Our surveillance and screening recommendations will then be made after that incident procedure. Most will then have follow-ups either 5 or 10 years.
I see. And then if there is some significant findings, probably more frequently than...
Potentially, or if there are genetic syndromes that are found and other things that make surveillance intervals a little different than the average patient. Yes.
So are all patients a candidate for an outpatient endoscopy center? Would everybody be able to have that, or are there some patients who might need to have their procedures in the hospital?
Yes, so that's a good question. So actually, there are actually screening things that we go by to determine where patients are best served. So those patients who are deemed uncomplicated based on scoring systems will be done here in this outpatient unit. Those that are deemed more complicated will continue to get their services at our inpatient unit at the hospital.
And since you will always see the patients prior to the procedure in your office, in your gastroenterology office, that would help make that determination. Is that correct?
That is true. Although I will tell you that there is going to be a plan ultimately to potentially do what's called open access colon cancer screening, where there'll be algorithms determined to help get patients in without that preclinic visit. That'll make it much more effective and productive and an efficient system. We're working to that. We won't start with that at the initial opening of this facility, but we hope to get to that at some point soon.
Yeah, I know that in some facilities that is sort of the way to go. Well, that makes sense. But it sounds like that the majority of the patients probably would be able to be a candidate for the outpatient center.
That is true.
Yeah. Well, before we leave this room, is there anything else that you would like to add?
I would just say that this is a fantastic facility. I think that our patients and colleagues out in the community will benefit from this facility, and we're happy to provide the highest level of care at the facility. So.
I love the facility, the convenience of the facility. The parking is wonderful. There's no traffic. We don't have to go across the bridge. And I think that the access is just much better for the patients here rather than at the hospital.
I would agree, yeah.
It's just much more comfortable.
Yeah, I think so. I think we're going to find that it's going to be an overall good experience for our patients.
Yeah. Well, thank you so much. It's been a pleasure to have you on the show. And now we're going to head over and check out the new Novant Health Gastroenterology Brunswick, where I believe your office is.
Yes, I think so. Thank you.
Great.
This is what security video used to look like, and this is HD video monitoring from ATMC Security. Now it's easier than ever to keep tabs on the kids, see when deliveries arrive, and make sure your home is secure. Check in from any device, anywhere. ATMC Security offers remote access, real-time alerts, video monitoring and recording, and more. Combine smart home solutions with 24/7 emergency monitoring for one great low price. ATMC Security. Safeguard your home.
Do you have Wi-Fi dead zones in your home? If you have a fast internet package, your wireless router is most likely the bottleneck because it can't handle all the new devices in your home. We now have a solution to enhance your internet experience. ATMC Premium Wi-Fi improves performance and coverage issues in any size home. For only $7.95 a month, you'll get Wi-Fi service plus management and maintenance you can rely on. So transform your Wi-Fi dead zones into total home Wi-Fi coverage with ATMC Premium Wi-Fi. Stay connected with ATMC TV. Like us on Facebook today.
Dr. Rice, thank you so much for taking time out of your day to be with us and help give us the opportunity to tour Novant Health Gastroenterology Brunswick.
Sure. Glad to be here.
Well, before we get started, there may be some viewers. I know you've been on our show before, but there may be some viewers out there who haven't met you or haven't seen the show. So tell me a little bit about yourself.
So I'm Doug Rice. I'm one of the newer additions to the practice. I came down here in around end of October 2017. Moved down from Indianapolis. My wife and I moved down. I just to give you a little bit of my background. I was in a large practice there in Indianapolis, and before joining here, the hospital employee group. Before that, I had done the majority of my training. I guess I should back up. Let me go back to medical school. I went to University of Kentucky. We'll get start there. University of Kentucky College of Medicine, graduated from there, and I did my intern year at Ohio State, and then went back to University of Kentucky, finished up my internal medicine training there, stayed on there for a chief year, and then did my gastroenterology fellowship at University of Kentucky as well.
Right. Well, we're glad to have you here. It's a pleasure to have you. So what can you tell me about Novant Health Gastroenterology Brunswick? That is a mouthful.
It is it's a long title.
So tell me a little bit about the practice.
So in the practice here, we treat a pretty broad spectrum of GI problems. It can be anything from a patient coming here that may need an endoscopy for something like reflux, esophagitis, ulcers, something like that, all the way to, we pretty much cover the esophagus, the stomach, the pancreas, the colon. Also, the liver is a very important component.
Right.
Hepatitis is
that's a big thing here.
It's a big thing, yes. We do a lot of hepatitis treatment here, hepatitis C, hepatitis B. So anybody that has it's basically a broad spectrum of GI illnesses can come to our practice, and it does not always involve the scope. There's a lot of medical management that's done here as well.
Yes, we just toured the endoscopy suite, but I know that you guys do a lot of other things besides just scoping. So wanted to bring them here to learn about what else you do here. So it is a wide variety of services. So it must be really convenient to you, though, to have the endoscopy center next door. I'm sure that cuts down on your time. Is that?
Yeah, that's true. It is nice because we have the clinic on this side. They're technically two different facilities, but connected by a door. Exactly. So I can come in here in the morning and be scoping in the morning next door, and then maybe come here for an afternoon of clinic patients.
But there are patients that you will still scope at the hospital. Is that correct?
That's correct. Yeah, a certain subset of patients, depending on why we're scoping them, will be done at the outpatient endoscopy center. And then there are a few factors that we look at to decide who gets scoped here at the outpatient center versus at the hospital.
And are you taking new patients?
Absolutely, yes. I am certainly taking new patients.
Wonderful. Can you tell our viewers how they might make an appointment here?
Yeah, so I think the best way, there's a couple different things. A primary care provider can refer someone here, and that happens frequently. And that's kind of an automated process within our Novant system. And also from outside of the system, primary care doctors will refer. If a patient decides that they want to see a gastroenterologist, they can self-refer as well. So I would advise a patient who they can discuss it with their primary care doctor, or they can just give our clinic a call, and we can kind of route them in the appropriate direction to what they need to do to make an appointment.
Well,
here.
you know, living in this area, there are a lot of folks who are here just part-time, and they know when their colonoscopies due. So if they choose to have it here while they're here in the area, they can just call, make an appointment with you all, and then maybe have their scope here.
Sure, and a lot of times they'll come in and maybe it's a visit for a colonoscopy and they have something else going on that they want to address as well. So that happens frequently in the office that we can address. They may have reflux disease or something else that goes along with that. We can get their screening colonoscopy taken care of and also address some of their other issues they may be having.
How many patient rooms do you have here?
Let's see, on my hallway, I guess the total number is probably...
There's a lot.
Yeah, there's
so we're
probably
going to take a look at one of those rooms.
We usually have, each physician usually has 2 rooms going, and we kind of alternate back and forth. But we actually have more rooms right now. We have a lot of room for expansion.
Right, we're planning
right
for
now,
the future here.
But the hallway that I work in typically has about 5 rooms over there, but I work out of 2 of them at a time.
2 at a time, that's great. Well, thank you so much for being with us today. We appreciate you being back on the show, and we look forward to having you back at a later date.
Thanks, Jim.
You're welcome. Thank you for tuning in to ATMC TV's HealthWatch. I hope you enjoyed the tour of the new facility today. If you have any questions or topics that you would like to see discussed on a future show, please email those to atmctv@atmc.com. For more information on Novant Health and local doctors, please visit their website at novanthealth.org. Thanks again for joining us today. Be sure to join us next time for HealthWatch on ATMC TV.
We have a very large population of patrons who need large print materials. Some of our patrons only read large print materials and cannot read anything else. And we had a very small percentage of our collection that was large print. In fact, 8% of our collection is large print materials, but 11% of what circulates in and out of this library is large print materials. So there was a need to increase the number of large print books for our patrons to entertain them, diversity of reading, improve their quality of life. We were able to purchase 80 books with the grant money that we received from ATMC, and that money purchased fiction as well as nonfiction, as well as biographies. We are very grateful to ATMC and the grant that they provided to us so that we could purchase those large print books for our patrons. It gives them the opportunity to have access to reading materials that they would not otherwise have. Fiction stories, as well as nonfiction and biographies, so that our patrons can continue to interact with the world around them through the printed word.
Do you have Wi-Fi dead zones in your home? If you have a fast internet package, your wireless router is most likely the bottleneck because it can't handle all the new devices in your home. We now have a solution to enhance your internet experience. ATMC Premium Wi-Fi improves performance and coverage issues in any size home. For only $7.95 a month, you'll get Wi-Fi service plus management and maintenance you can rely on. So transform your Wi-Fi dead zones into total home Wi-Fi coverage with ATMC Premium Wi-Fi.
At ATMC, it's all about you. So when you build your own bundle, you get exactly the services you want. Like blazing fast internet with speeds up to 1 gigabit per second. Connect all your devices. And when you add premium Wi-Fi, you get whole home coverage. Here, here, and here. Add digital cable, unlimited home phone, plus security with smart home solutions, and save even more. Because it's all about you. Build your bundle with ATMC.
Why did I choose ATMC Security? Convenience and control. Right from my phone, I can arm my security system, adjust a thermostat, control lights and locks, even close the garage door. From almost anywhere, I can control home features that help keep my family safe and comfortable.
Get 24/7 protection, home automation, and video monitoring as low as $36.95 per month.
Affordable convenience and control. That's why I switched to ATMC Security.
Choose ATMC Security today.
At ATMC, it's all about you. So when you build your own bundle at atmc.com, you get exactly the services you want, like blazing fast internet with speeds up to 1 gigabit per second, more than 200 channels of digital cable, unlimited nationwide calling, plus the safest home on the block. At ATMC, you get faster speeds, more choices, and bigger savings, because it's all about you. Build your bundle today with ATMC.
This is ATMC TV, your community channel.